Phua from Center Balance, the acupuncturist. Now, today's topic is about acupressure point for fibroid treatment. Hi, happy day. How are you? So, acupressure point for fibroid treatment. That's what we're going to talk about today. Now, we talk about acupuncture strategy and Chinese herbs for fibroid treatment, right? But today we're going to talk about acupressure point. Now, the acupressure point is a bit different with acupuncture because when it comes to acupuncture, you really have an acupuncturist to set up the strategy, the acupuncture protocol for you, right? And when it's actually individually tailor-made the herbs and acupuncture formula, acupuncture point formula for you to suit your individual conditions. Right? Then, therefore, however, when it comes to acupressure point, you kind of know you don't have an acupuncturist to sit there and talk to you and then give you some idea and to change the point for you. So when it comes to acupressure point, we choose the point that no matter what type of conditions and what type of fibroid you suffer from, or what kind of condition individual body that you are, and we're going to set up some point that is a general point that suits for all of the fibroids. So which means any type of fibroids that you suffer from, then it's going to work for you. Does it make sense? But there's no point for me to set up an acupressure point formula for you and then to tell you if you have this type of fibroids and you do this, if you have this type of fibroid, you do this, if you have this type of fibroid, you do this. No, there's no way for me to say that. Okay. All right. Now, hi Veronica, nice to see you. Thank you. And Eric, thank you for being here and supporting me. Thank you very, very much. All right. Then let's start then. The acupressure point. All right. I'm very good. Thank you. Happy day. Now, if you are in this live video, please say hello to me and then give me a thumbs up and share this video. Share this live video in your social media. If you're on Facebook, share on the Facebook page. If you're on Instagram, please share with anyone that you know might need this information. Right? Thank you very much. Okay, the acupressure point, the general one, we want some points that are treating all the organs. So I repeat it again and again and again in many disease, many topics when it comes to acupressure point, which is 3-1-2 at meridian method, right? So that is from Master Zhu from Beijing. He, I think he's over 100 years old now. And those points, when I discover those points and I teach my patient to do that, and I actually read all the material that available online, and a lot of people use this only 3 points that acupuncture point to lower blood pressure, cholesterol, and blood sugar, and many other disease, and balance hormones. Balance hormones means a lot of pain as well, and emotional issues when it comes to menopause. Okay, when it comes to menopause. So those 3 points are a key point to balance all organs. So I'm not setting out and take a pulse and see, oh, hey, you have your lung and last position out of balance, and you should use this point, this point. Doesn't matter. When it comes to acupressure point, you don't have an acupuncturist, and I can't check your pulse, I can't collect all the information, but hey, just do this 3 points, because those 3 points will balance all organs. Doesn't matter which organs are out of balance, which means it's not focused on certain organs, but it is actually work for all the organs. Okay, so to be honest, I suggest all my patients to do this 3 point daily. When I found that if my patient, of course, not everyone listen, not everyone practices daily. But I do practice it daily myself, and all my patients, if those are practicing this acupressure point, and you will see the results lasting for longer, and as well as the results speed up very, very fast. So believe it or not, you tried it, you try it yourself, and you try it on your patient, okay? And you get your patient to do it, and you ask your patient whether they do it or not if you're the practitioner, and if they do it properly, then that's how, and compare with the others that are not doing it, and you compare with it, and you'll see that the results speed up very, very fast. Or if those hasn't been doing it, you encourage them and remind them to do it. And once they start to do it, you find, wow, when our treatment comes to one point that it can't go any further, when they start to do a daily exercise of acupressure point, and you find, wow, starting the next week they come back, things that improve a lot. Hi, Naomi. How are you? Thank you for being here. All right, here's the point. The first point is 合谷. Now, because I repeat it again and again, then I know what 合谷 point in the English code is called. Large intestine 4, right? It's over here. Right. This is the first point. So use your if you're not an acupuncturist and you don't know where it is, so put your thumb closer to your index fingers, where the highest point is. Right. This is 合谷. This is a very good point, and large intestine meridian. So, or you use the crease over here and to match here and to do this. So have you done this yet? If you've been following me on the video, and have you done this today yet? If you haven't, now is the best time to do this. Okay. So people do this. Like I have another patient come in yesterday, and I asked her, "Have you done the acupressure points?" Yes, I have done it, and she showed me how she did it, and she just do it this way. I said, "Wow, that's great. You got the right point, but if you try on this, grab it like this, and you put on here on this position and grab it like this. Which one's more stronger?" You'll find this one more stronger, especially when you dig it to the bone, right? It's much easier to do the acupressure point. Okay, so my suggestion is do it for 1 minute each point. All right. So 合谷 point is just one, but if you know the holographic theory, so you do it from here, so which last intention 3, 3, 4, move toward to here, from here 3, move toward to here, right? So get the most sensitive one. So you get 1, 2, press 3. Like my one, I only feel a little bit in here, but you may feel a lot of, because I do it every day. I dig it and do acupressure every day. So in here, so that's a bit more sensitive. So I do this. I can do this for about a minute. So make sure you do it down here. So most of the time you get very sensitive in here or in the bottom in here, right? It can be in here, but anyway, I don't know which one is going to be sensitive for you, but any point along here, when it's sensitive, do it for 1 minute. Okay, do it for 1 minute. I want to tell you that this is very good point for any pain. So if you have tummy pain, fibroid cause any pain, do this. Okay. Now, second point is PC6, which is 内关, okay. PC6 make one. So over here. So over here, so 3 fingers from the wrist, yeah, right, and 1, 2, 3, and lower 1 level, and up 1 level, 1, 2, 3. So 3 fingers on this level, above 1 level, and below 1 level. There's 3 level, 1, 2, 3. So 3 level, right? You go for 1 in the middle, side, 2, 3. 1, 2, 3. In each level, you have 3 points. 1, 2, 3. Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. And how do you do that? Use a knuckle to detect any sensitive point. You want to dig deeper, right? So I want, like, you know, if you do it in the middle, it's between 2 tendons. Between 2 tendons, if you dig deeper, you may get sensation up down to your fingers. Okay, because there's a nerve in there, right? So this is another point that I suggest all my patients to do. It's not 九宫八卦，内功内关 ，OK， 内功内关，九宫内关，内功 is from law school, okay? It's got a image in there. Very effective for stomach pain as well, and for nausea, and for stomach pain, and for acid reflux, okay? And it can treat a lot of things that over here, 3 points that you cover. It can treat all the organs. And all those 3 points over here, 9 points over here, and you work it out which one sensitive. For those are not sensitive, you dig it in, no sensitive, forget about it. Only focus on those sensitive points, all right? And when you got to the sensitive point, keep digging, keep massage for about 1 minute. That's it. So simple. Okay, so simple. Now the next one is over here. So below your knee, there's in the external side, the internal side, there's knee eyes. So there's hollow. There's hollow below your kneecap. There's a hollow. External one and internal one. The external one means on the pinky side, right? The internal one means on your big toe side. Okay. So on the pinky side, the hollow, 4 fingers below that. Then when the 4 fingers below that, and that is sin bone, right? And 1 finger out of the sin bone. So you go around it and get the most sensitive point again. When you get the most sensitive point, do it for 1 minute. That is stomach 36. 足三里. It gives you a lot of energy for that. Okay. Apart from that, doing 2 legs exercise, or go for a walk, or do squash exercise for how long? I suggest you do it for 10, 20, or 30 times. Okay, we have video for that, but you can do that. You can do it on search online. So 2 legs exercise is important. Right. Left and right. Okay, you can do both sides. Or only you can do both sides. Okay, or you can just do one side, alternate it every day. Because I want to tell you that, I want to let you know, a lot of people do it too hard. They think the harder the better. Okay, and when they do it very hard, and the next morning, the next time they want to do it, oh, it's too painful, they can't do it. If that happens, hey, you overdo it, and just put a heat pack on, and you do it alternate side. Okay, so you can do both sides together, and then that's fine. But when you do both sides together, that take up more time. So take it easy, just do one side. Once in here, tomorrow, on that side, the next day, the next another side. So do alternate it. So this is not this is a treatment that can maintain your body situation. It can maintain your organs function. All right. So once you increase the organ function, a lot of things will change. The hormone will be balanced, and the pain will decrease in fibroid treatment. Does it make sense to you? So this is something that it actually covers all the organs for fibroids. So But apart from that, what can we do to the fibroid symptoms? So what sort of fibroid symptoms are we talking about? Well, the bleeding. Bleeding is one of the biggest symptoms for and pain, right? Pain and bleeding. So those 3 points, it may cover the pain, but not necessarily. They are more powerful points for pain from causing from fibroid as well. Let me show you some point over here. The acupressure point. This is spleen 6, 三阴交. Okay, 三阴交. 三阴交 over here are very good for fibroids pain. And how do you do that? For is this on both sides? Yeah, happy day. I just jumped. So I didn't see your question. It can be on both sides. It can be on just one side, right? If you have pain on those conditions, and you can do both sides. If you just have fibroid and the silent fibroids, which means silent fibroids has been you haven't got any obvious symptoms. You need only have a diagnosis from your doctor. Then when they did ultrasound, they say, "Oh, okay, you have a fibroid. You have a few fibroids in there, but it didn't actually cause any things, any conditions for you. No discomfort at all. So you just do those points. But alternative, here are the points that spleen 6 very good. So 4 fingers from the ankle bone on top of that. So you do what? Just right beside the behind the shin bone, next to the shin bone, and you go for it, and you press the point, do the acupressure point for 1 minute and up to 2 minutes. And my suggestion is, don't just do 1 point. If you want to get rid of the pain, you want to help the pain, go for kidney meridian, spleen meridian, as well as liver meridian. If an acupuncturist, you know what I'm talking about. If you're not an acupuncturist, here you go. So 1 point, 4 fingers above there, and around that you get the a point, and you go on top of the shin bone here. You press on it. There's no muscle, just bone, and you find it if there is any sensitive point. And you go behind the shin bone. There's 1 point very sensitive. That's spleen 6, and you keep going back to the calf area in here, and that is on kidney meridian. So from 1, 2, 3, all right. Keep going there. Keep going and press on any point from the front to the back here. From the front to the back here. If you can find, if you can detect any sensitive point, do it for 1 minute. And alternate it. I want you to do this from the 3, 4 finger here on the level, go down to the ankle, cover all this area, right? You may find just spleen 6, it will get rid of the pain, but some pain still there because what happened in here, there are a lot of different meridian involved, and spleen 6 only able to cover the spleen meridian and stomach meridian pain. Most of the time, it will cover very well, but it doesn't actually cover if the pain in your groin over here, and if it involved with a liver meridian or it involved with kidney meridian, it doesn't really cover very well. And if you do all the point, all the meridian over here, and it cover all the meridian, and it get rid of the pain instantly. But when I say get rid of the pain, it doesn't mean one off. We expect it come back again. So you do it daily, or whenever it's painful, you do it again. Does that make sense to you? Right, I hope it does. All right. Again, what else? What else can we do? What other points? Now, if you have Moxibustion stick, it's very good stuff, and you can do it over here too. And the Moxibustion can do it in here. One thing that I want to show you that Moxibustion, if on the tummy or heat pack on the tummy, it may not be good when it's bleeding. And how do you know it's good or not? Try it. If it causes more bleeding, don't do it. If it doesn't, it actually help with stopping the bleeding with Moxibustion, then keep doing it. You just need to take test it, experience it, right? And another one, Moxibustion in here. Moxibustion in the tummy is 5 fingers below your belly button. It's Guan Yuan point, on the Guan Yuan point. And Moxibustion, you don't directly put on the skin. You can do it this, up and down, It gets warm sensation, that's it. And when it's bleeding, a lot of bleeding, there are 2 points that I will suggest you to do Moxibustion. You don't do acupressure point, you do Moxibustion. Yes, you want to do acupressure point, that's okay, do on the feet, on the big toe one, right? Big toe, big toe, there are 2 points. And on top of your head, by Hui 220, that's 1 point of that, right? Okay, over here, by Hui is both ear on the top, and from the yin tang, or in the middle of your head over here, forehead, and go up there. That's 5 point. And cut a ginger, get a ginger about that thick, and then make some hole on it. Use fork, make some hole on one side, and turn on the other side, and make some more holes in it. And then you put it on top of the bai hui, and get the Moxibustion stick, light on, and put it on top of the bai hui 220, and burn it. Not actually burn it. Do not directly touch the ginger. The ginger in here is, if you get the heat go through the ginger, it actually creates more heat, more warming. Okay, it comes with a warming sensation in there. It works even better. And the ginger in there is try to stop you burn the hair, right? It helps a lot. So you push it on, put the ginger in with a lot of hole in it, and push it in. So push it and close it to the scalp, so it won't burn your when you put Moxibustion on the top, it won't burn here. Okay, so keep doing this until the patient feel, oh, it's getting warm. Okay, and I suggest this for about 5 minutes, at least 5 minutes. And it's very good to stop, to get the energy, to hold the energy up, so and stop bleeding. So there's one of the things that I do for my patient when they're bleeding a lot, or I show them how to do it and get their partner to do it daily. Okay, this is important. And what else can we do? And what can do for this? This is very good for miscarriage. If people have women who suffer from miscarriage and they're bleeding, do it. And that's very good for prevent miscarriage, and as well as hemorrhoid. I don't know whether you know about this. In hemorrhoid, there are 2 things that cause hemorrhoid. One is constipation. There is most cases in constipation, but there are some cases that it's actually come with diarrhea. They go for diarrhea, too much diarrhea daily, too many, too often, then causing hemorrhoid. We're talking about external hemorrhoid. Or yes, internal hemorrhoid and bleeding a lot, you can do that. So if you've got a lot of diarrhea, okay? And with diarrhea, you do this Moxibustion on top of the head. Or in the acupuncturist, then I'm going to introduce 220, 12 magical point, 12 magical, like Bai Hui 12. 12 needle on Bai Hui. So your needle, you treat all the organs, then plus ginger on and do this. And this is very good for all, lift up all the organs energy and stop bleeding and decrease or stop diarrhea, the water retard or lose time. Okay, this is very, very important, very, very important to do this. I've done this for my patient for diarrhea causing external hemorrhoid. It's so painful for her, and I did that with 1 or 2 sessions, and the pain basically gone, and the diarrhea stopped. So it's very, very powerful, and I do recommend that you do this if you have patient with diarrhea with hemorrhoid painful hemorrhoid, or bleeding, any type of bleeding, and not just fibroids, but fibroids does make bleed, cause bleeding. Okay, this is one of the things that I would add on when I do acupuncture. Okay, what else? Okay, here, 2 point here. I think it's spleen 1 and liver 1. 硬白跟大敦. I'm not quite sure what is it. The English should be spleen 1 and liver 1, right? Yes, I'm pretty sure because it's kidney 1. Okay, so you do on basically the by spleen 1 is the best point, but we found that the 大敦 is actually been written on the textbook, and we use both. And with those both, it's very good for, they are very good for bleeding. Okay, so Moxibustion on those 2 points, and those 2 points will be in here, just on the side of the nail, the fingernail, toes nail. Okay, if that is the nail of the toe, on the side, on both sides, here and here. So you can do pressing acupressure point using your nail, fingernail, and you press on the toe nail beside it on those 2 points. You give it about 60 times. You press it about 60 times, and it helps. Or Moxibustion on those points. Again, Moxibustion for 5 minutes, 5 minutes. Moxibustion, you need to take long about enough stimulation for about 5 minutes. Okay, an acupressure point, normally I suggest 1 minute or 2 minutes. Okay, you can do 5 minutes if you want to. Okay, those are the acupressure point for fibroid treatment. So first we have 3. Let's get a conclusion. First, we have 3 major points. Large intestine 4, which is in here. We do acupressure. We do spleen, pericardium 6. You have 9 points in here actually. Okay, 九宫, pericardium 6. The second and third, you got 足三里, stomach 36. Right. And apart from that, it's very painful. If this those 3 points are for all the organs, balance all the organs, get better function on all the organs. Okay. Then for the fibroid symptoms, painful, bleeding, especially for painful, you do spleen 6. All right, here, and cover all 3 meridians here and get acupressure point around this area. From spleen 6 to ankle, right? Cover everything. Then this is the 4th. 5th, you do you can do Moxibustion on spleen 6 as well. And 5th, you do Guan Yuan, 5 fingers below belly button, and use Moxibustion. Okay, 5. And number 6, you use Bai Hui, Moxibustion. Okay, you don't do acupressure point here. Moxibustion with ginger. 6, 7, you do spleen 1. In 8, you do liver 1. Okay, so 8 different acupressure points that for you. Some of them with Moxibustion, some of them just using your hand and press it. Right, and the last 3 one, like Bai Hui and liver 1 and spleen 1, they are very good, effective for bleeding. Okay, so there's something that you can do at home. Right? Then apart from that, I suggest you to see an acupuncturist if you're a patient, and if you need Chinese herbs, you take Chinese herbs. If there is no condition at all, like no bleeding, no pain, and you want to get rid of it, you worry that it get bigger. That is something that you can do at home and get regular acupuncture and to sort out the hormone. Then it will shrink down. Right? It's possible, and even possible that it may pass out. Or you can just do this treatment at home yourself, and when it lead up to uh, uh, period time, the bleeding time, then you get acupuncture to help it pass out. Not every of the fibroid will be able to pass it out. You need to see your Chinese doctor and acupuncture to discuss which type can pass out when it comes period. Okay, it's possible. Okay, all right, that's it for today. And please give me a thumbs up if you like this video. I'll see you tomorrow morning. Again, 7 o'clock or 7 something that we're gonna go live. It's about half an hour now, so I have to go now. So thank you for being here and supporting me, and I hope you enjoy this live video. This is about acupressure point, and I hope that gives you some idea what to treat if you're an acupuncturist. Thank you, Veronica. Right, that's it for today. Stay awesome, and I love you all. See you tomorrow. All right.